Good morning, class. My name is Liza Wall. Today I will be discussing my prevention plan. It is entitled Improving Mental Health in Preschool Aged Children. And without further ado, we will go ahead and get started. I would first like to define a vulnerable population, which is a subpopulation that shares similar characteristics for high-risk health conditions. Children unable to rely on themselves depend on parents, guardians, and governmental assistance to meet basic needs such as food, water, and shelter. This makes children a vulnerable population. Health disparities in children include obesity, diabetes, chronic respiratory issues such as asthma, along with mental health disparities such as anxiety and depression. Poverty has been shown to have a direct correlation to the prevalence of such health disparities. Due to the decreased quality of housing, toxins and pollutants from smoking, and prevalence of abuse within the home and crime outside the home. The lack of quality food and lack of education for exercise also contribute. With over 50% of the children living in East Central Mississippi classified as impoverished, health disparities are on the rise. Toxic stress is an overpowering stress response to adverse childhood experiences, also known as ACE. These experiences can be caused from abuse, physical, mental, emotional, sexual, or can be a lack of nurture and care from family figures. Financial insecurities and housing insecurities can also contribute. It creates a state of chronic stress that in return increases health disparities among childhood and adolescents. Toxic stress will be the main topic of this prevention program. My clinical question for this prevention plan is, does implementing annual toxic stress screening versus no annual toxic stress screening improve mental health in preschool aged children? This prevention plan will be broken up into 3 different phases that span the course of 1 year. The first phase is primary prevention, second phase, secondary prevention, and the third phase is tertiary prevention. The first phase of this prevention plan is primary prevention, which is preventing or inhibiting a disease from ever occurring, which will be completed through education. Although the Center for Disease Control and Prevention recommends understanding the effects social environment has on mental health, nearly 20% of students ages 4 to 18 have ever heard of ACE, while 65% have never heard of toxic stress. In addition, only 17% of parental guardians have been informed of toxic stress and the barrier it creates later in life with children and students by their pediatrician, nurse practitioner, or primary care provider. The lack of education is presumed to be linked to an increased factors contributing to toxic stress, reinforcing the need for education. And so every student will be educated on toxic stress and ACE, and every parent and guardian will also be educated as well. Phase 2 is secondary prevention, which is defined as disease detection in healthy individuals with subclinical forms of the disease. As I mentioned before, toxic stress can occur from an array of different stressors, including physical abuse, financial insecurities, and neglect. Students, parents, and school faculty are all involved in the screening portion of this plan. There's 3 different screenings that will occur. The first one is a physical assessment conducted by the school nurse during the annual hearing and eye exams. And this is going to look for signs of abuse, including various stages of bruising, scratch marks, burns, or any unexplainable physical injuries. This also includes or can include verbal confirmation from the student that abuse is present in the home. Physical signs of abuse will be assessed on the arms, legs, feet, and hands. In order to provide privacy to these students, because this is a sensitive topic, the assessment will occur in the school nursing office. The second portion of the screening protocol will be within the classroom, analyzing attendance, school discipline by the teacher and school faculty. They're going to assess for abnormal behavior, school attendance, chronic disciplinary actions that are needed, impulse control and or signs of impaired learning or decreased attention span that are all signs of toxic stress. Significant findings may include any signs of abuse or unexplainable school behaviors or patterns, for example, undiagnosed ADHD, ADD, or any other behavioral issues that are not correlated to a prior diagnosis.